Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always begins with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today I want to introduce you to Dr. Brian Budgell, who's conducting important research about spinal stenosis.
In general, compression of spinal cords causing a decrease in blood flow is a bad thing. This is most likely the mechanism by which spinal stenosis in humans produces pain and paresthesia, disturbed sensation, and muscle weakness. The acute experiment in animals promises to be able to relieve those symptoms.
Spinal stenosis is a disorder that affects a large portion of the over 60 population. It happens when two vertebrae in a disc start to compress and squeeze the disc against either the spinal cord or the adjacent nerves. This causes a great deal of pain that becomes chronic. It's horrible.
At this moment, however, it's difficult to study the disease because we don't have a good animal model.
This is exactly what Dr. Budgell is in the process of applying to his research, an animal model. A small device is placed at their vertebral column to compress the spinal cord and mimic the disease in humans.
What we have already in the animal is that in the very short term, over a period of minutes, if we compress the animal's spinal cord and decrease the blood flow, which one would think would be bad for a spinal cord, with the stimulation we use, we can bring that blood flow back to the pre-compression level, and we can keep it there so far for the 15 minutes of stimulation. That's the duration that we've chosen to use.
These types of experiments are extremely difficult to perform without animal testing, yet are subject to approval. We do not have the technology to monitor second-by-second blood flow within the spinal cord of human beings.
We're now going in two directions. We want to apply this treatment in the clinic to see if we can make it work in the clinic to help human beings. We also want to do longer-term experiments in animals so that we can understand very precisely the mechanisms of the disease.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow through better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.